大家好，欢迎各位老师上线参加本次课程。我是爱尔全球视觉 AGBC 爱尔眼科医院集团的沈冲。首先呢，非常感谢各位老师百忙之中上线来参与这个学习。不好意思，今天由于这个登录的信号的问题，然后耽误了一些时间。今天呢是我们本年度 ICL 国际大师系列课程的第2节。我们今年呢是预计在3到6月份每隔周的周二晚上20点到21点10分，邀请国内外顶尖的 ICL 手术医生为大家带来有关 ICL 晶体、长期安全性、患者选择、手术技巧等一系列的精彩课程。也欢迎大家关注爱尔全球视觉 AGBC 的公众号，了解更多的课程的详情。我们今天呢也是非常荣幸的请到了德国的 Detlev Breyer 医生为我们带来 ICL 晶体散光 ICL 晶体植入方法的一个经验的分享。在此呢也给各位老师介绍一下 Detlev Breyer 医生，他是德国杜塞尔多夫的一名眼科医生，在那边有自己的私人诊所，目前呢也已经是完成了超过45000例的手术，其中在 ICL 手术和晶体置换手术方面呢是有非常高的这个声誉，也是有非常多的经验。然后我们同时也是非常荣幸的请到了李少伟院长担任课程的点评嘉宾。少伟院长呢是爱尔眼科医院集团北京爱尔英智眼科医院的 CEO，也是爱尔眼科医院集团角膜病学组的带头人，他会一同参与到这个今天的讨论中来。同时呢，我们也是非常荣幸的请到了北京协和医院的杨志坤主任担任课程的助教，他会对课程的内容呢进行一个详细的解读。所以如果各位老师有任何的问题，欢迎在评论区留言给我们，我们会请专家在这个会后来进行解答。So, Dr. Breyer, I just give the audience a brief introduction of you, and now let me officially introduce Dr. Li Shaowei and Dr. Yang Zhikun to you. And Dr. Li Shaowei from Beijing Ayer Intech Eye Hospital will be the special guest for today's webinar. He is the head of the academic committee of corneal disease of Ayer Eye Hospital Group, and he will join the panel discussion together with you today. And Dr. Yang Zhikun from Peking Union Medical College Hospital will be the interpreter for your talk today. He's a very promising young doctor and fluent in English. And of course, we will be running a Q&A session at the end of the webinar. So anyone who has any questions during the presentation, we will collect them and ask you and Dr. Li from Beijing to answer the questions. So now I will give the floor to you and to Dr. Yang Zhikun for your lecture.
Okay, so I start to share my screen. Is that fine?
Yeah. Yes.
Okay. So I shall scare you. Cannot. Okay. So share screen. This is the presentation. So you're fine when I start right now? Can you hear me?
Yes, you can.
Yes, we can.
Okay. My hello from Abu Dhabi. I'm just on holidays, so you can see me speaking from my hotel room. And thanks for your kind invitation. It's a great pleasure to share this presentation with my doctor friends from China. So I think there was really, during the time I take care of toric implants, a real revolution. That's why I called it a little bit a revolution of the implantation of toric implantable contact lenses or toric IOL. That's where I'm from. I'm from Düsseldorf, Germany. This is in the western part of Germany, close to the Netherlands. This is a concept.
Excuse me, sir.
Yes.
Would you just please give me a pause, then I can translate those words for you.
Good.
Okay. Dr. Breyer 医生呢，他目前呢正在休假，他是在迪拜呢和大家分享，他在他酒店的房间里，然后他也希望呢能够从迪拜呢向大家问好，包括这个很多线上的同道和朋友。然后他今天呢要和大家分享的内容呢，就是 TCL 这个植入的这样的一个手术的演变，可以叫演变，也可以叫一个革新。下面就是他将要介绍的主要内容。Okay, you can go on, please.
Okay, so this is the concept of this presentation. I want to talk about the chronicle order of my personal experience with toric implants overall. So I kept this not with number crunching, but telling it like it is. And I'm, of course, looking forward interesting discussion. So would you like to translate after every slide, or you just interrupt me?
Okay, maybe every slide you can maybe stop for a while. Okay.
Okay, so I stop for a while now.
Okay. 今天呢 ，Dr. Breyer 要介绍的主要内容呢，包括以下几个方面。首先，第一个呢，就是他个人在这个 TICL 散光晶体植入方面的一些个人的经验。这里面呢，可能并不是一个具体的数字，他的这样的一个介绍，而是呢，把他整体的一个就是他手术的经验的这样的一个历史，一点点的和大家分享。最终呢，他也能够希望和大家有一个非常好的一个讨论，让大家呢共同进步和学习。OK。
Okay. So that's how it all started. In that time, we didn't have yet toric ICLs. So I had the big pleasure to implant toric IOLs, being one of the first in the world, because I was working together at this time with a company Architect, which later on was bought by Carl Zeiss Meditech. And as you can see at the beginning, it was very basic, marking the horizontal axis using a Mendes ring. And if you look at the story and history of this revolution or evolution, we are now using marking methods with eye trackers.
大家可以看到，在最开始的时候，我们知道 ICL 最开始呢，也是从没有散光的晶体开始，后来呢，它有了带有散光的 ICL。然后最开始的话，我们也需要先进行一个这样角膜水平位的标记，然后在术中呢，再通过 Mendes 这样的一个角膜定位环呢，来标记一个目标的轴位，然后在术中呢，再对晶体的进行旋转，达到一个这个矫正散光的这样的一个效果。OK。
So that's what we did at the very beginning in 2002 when we started to implant toric implants. We used the Mendes ring. So first of all, we marked the horizontal axis with a needle at the limbus at the slit lamp. Then we used the Mendes ring. Disadvantage was, of course, that was okay, but not really precise, as you can see here. And those time, being a pioneer in this field was more art than science.
OK，在最开始的时候，我们也就是在2002年的时候，我们开始植入了 TICL。这个时候我们都知道，其实就像我们现在国内很多医生所做的一样，我们首先呢要在裂隙灯下对角膜的在角膜缘呢进行一个水平轴位的标记，然后在术中呢再使用这个 Mendes 的角膜的这个定位环，然后标记一个目标的轴位。它的一个缺点呢，就是说我们能够比较如期的完成手术，但它的精确度呢仍然存在着一些缺陷。另外一些呢，可能对于我们的技巧方面有一些要求，也就是说它的艺术方面可能更多的多于科学。OK。
So the next step was a so-called log principle plumb marker, where we marked the horizontal axis. Later, you were able to mark the target axis. It was done in topical anesthesia, and the patient was sitting, as shown here, in an upright sitting position with a straight view.
之后的一个方法呢，就是使用的这样一个我们其实现在也可以用到一个角膜散光的一个标记器。我们首先呢是使用亚甲蓝对这个标记器上的这个水平轴，然后进行一个染色，然后呢患者是在表面麻醉之下，他是在一个直立座位就向前直视的这种方向下，我们对他的眼睛的角膜的水平轴呢进行标记，然后另外之后呢再对他的目标轴位进行标记。OK。
So what were the disadvantages of this method? Staining was not a steady method. It could blur. Sometimes you could see the corneal impressions still being there, but sometimes they were not always visible anymore. And of course, if you're marking this way, you very much depend on patients' compliance. And sometimes if they were older people, or if they have a very deep set orbit, or if the patients were stressed and anxiety patients, it was not what you really wanted to have as a method for a precise surgical procedure.
当然呢，使用这种角膜散光标记器呢，也存在着一些困难或者说缺点。首先一个呢，就是它的染色有的时候并不是很稳定，我们有时候在标记之后再看它染色呢就变得模糊了。另外呢，我们在术中的时候，有的时候可以看到它角膜的印记呢很清楚，但有的时候呢也不是很清晰。再有一点呢，很重要的就是说它有赖于患者的一个配合。我们知道有的时候我们会面临一些年龄比较大或者比较紧张或者眼窝很深这样的患者，这样的标记的时候呢，都会对我们的操作呢产生影响。OK.
So then this old plumber was replaced by a more modern one, which was more had a better design, was also good for a deep set orbit, was better to hold. It was called the Gerten plumb marker, which was invented by a surgeon from Cologne, so 30 kilometers next to my city.
之后呢，我们根据这种不足的地方呢，又进行了一些改进，这个是我们改良的一个，也就叫它叫 Gerten 的这样的一个角膜标记器。它的优点呢，可能是对于我们的这个本身的握持，包括在一些深的眼窝的这种情况下呢，它的这个使用的这个会更为精准。OK。
So then we tried to optimize the position of the bitoric then IOLs, as we didn't have ICLs then. And we showed and published it on the German and the European meeting in 2005. And as you can hear, we tried to raise the precision to another level by improving the precision by magnification using this foil that was then single produced for every single patient, and you could have an overlay over your monitor.
之后呢，我们采用的一种方法呢，它也是一种优化的方法。当时呢，最开始也不一定是完全是使用咱们的 TICL， 也有一些呢是咱们的 IOL 这种人工晶体。然后我们的这样一个研究或者发现呢，也在2005年的这个德国的眼科的会议以及欧洲的眼科会议上呢进行了这个发表。然后我们这是使用了一个，我们可以把它称为一个就个体化的一个独立的监视器的一个定位箔，这样呢就可以通过手术显微镜以及监视器的这种放大的效果，而达到一个更精准的一个定位效果。OK。
So here you can see it's a little movie how we did it. That was my assistant while he is telling me if the position of the IOL is right. So that's how we did it in everyday life.
这里面呢，给大家放一个小的视频呢，就是说我的助手和我是如何一起配合，在术中呢对这个轴位进行标记。大家可以看到，他拿了一个类似于透明的这样的一个纸箔，然后贴在我们的监视器上，然后由他呢来告诉我，然后我这个定位呢是否准确。我们日常呢每天的工作都是这样完成的。OK。
Okay, so then when the company Architect was sold to Zeiss, I invented together with the engineers from Zeiss turnable, multi and not single-use foil. We called it the Stacy, and it was very soon adapted by all other companies. Unfortunately, I didn't put an intellectual property on it.
之后呢，我们也是与蔡司公司呢进行它的工程师进行合作，然后呢一起这也相当于是研发了一种这样的可以转动的，然后可以多次重复使用的这样的一个箔。然后这样呢，当然我们其实可以在这方面呢进行更多的研发，包括一些专利的申请。那这里面只是和大家分享一下。OK。
The next step, how we tried to improve the precision, was by marking with a YAG laser. So we used a special ocular to mark the horizontal axis and the target axis. I'll show you later on. It was much more patient-friendly, and you had a better reproducibility because the patient was sitting very comfortable and quiet, and it was a no-touch technique. So that in everyday life it doesn't sound spectacular, but in everyday life it was a real improvement because the patient was not frightened. There was no rolling of eyes. You had a better cycle torsion control. It was more precise because you had no blurring of staining dye, and you had smaller marks and therefore more precise marking.
之后的一个方法呢，是我们使用那个亚克激光，然后呢进行一个标记。我们可以使用一种特殊的目镜标记水平轴，在这种情况下呢，患者就可以做得很舒服，而且呢，我们的这个镜子是不直接接触到眼睛的，对患者呢也更友好、更舒服。那它的重复性也更好。在这种情况下呢，几乎不会存在眼球的旋转，这样会获得一个更好的眼球旋转的一个控制。而且呢，由于本身不存在染色的问题，而且我们的标记的更小，因此也能获得一个更精确的标记的效果。OK。
Okay, here you can see the ocular mark with a special design. And then we also marked not only the horizontal axis, but also the target axis. So you didn't need a Stacy anymore.
大家可以看到，这就是我们使用的这样的一个目镜，它是有一个特殊的设计，而且我们不光可以标记水平的轴位，还可以标记目标轴位。有了这样的一个镜子的这种标记的方法呢，我们就不再使用 Stacy 这样的方法。OK。
So the first improvement, as I told before, was the YAG marks. The better byproduct was a very good workflow by delegation, because you as a surgeon didn't have to do it anymore. You didn't have to do it in the OR, so the workflow improved as well. The disadvantage one was if the epithelium was healing too fast, you couldn't see the marks anymore. So I told my assistant doctor to mark with a little bit of bleeding. So you didn't only have an epithelium defect, but if you took a limbal mark, you also had a little bit of bleeding and a little bit of conjunctival laceration. So you could see the mark longer. Disadvantage two, it was still an outside OR procedure. So even it was doing assistance, I didn't have to do it myself anymore. You had to organize the workflow. And the disadvantage three, it still had to be done by a doctor. You couldn't delegate it to an optometrist or an assistant.
然后我们使用 YIG 激光标记的这种方法呢，它可以带来我们整体从授权包括工作流程上的一些改善。这样呢，就不用由我这个主刀的医生本人完成这样的一个标记，而可以由我们的助手呢，进行这样的这个标记的这个流程，对于我们整体手术的流程的改进呢，会有一些帮助。当然，这种方法呢，仍然存在它自身的缺点，因为本身呢，我们标记的点很小，然后有的时候如果上皮愈合很快的话，我们在做手术的时候，有可能在观察起来呢，会存在一些的困难，因为我们知道，如果我们用针去标记的话，有的不光是在角膜上。有的时候呢，针还会划到一点点结膜组织啊。这个时候我们其实看标记呢会更清楚，这是第一个缺点。第二个缺点呢，就是说，因为我们的激光机器呢是在手室之外的，所以说呢，仍然需要在手室之外，我们需要把我们的整体的手术的流程呢进行一个很好的设计。我也需要和我的这个助手去沟通啊，我们形成一个很好的配合，什么时候进行标记啊，然后再进行手术。第三点呢，就是说我们这个过程呢。仍然需要由医生完成啊，对于我们的本身的资质还是有一些要求的。OK。
So was intraoperative aberrometry the way to go? It was partly very popular if you went to the ECS or ESCRS meetings or Asian Pacific meetings. I never was a big friend of intraocular aberrometry during or after surgery, because there were too many factors that could lead to another result than the one you like to. And as much as I know, I don't know a single surgeon that does intraoperative aberrometry today for marking toric axis for horizontal or target axis. I don't know anybody, but at least it was fashionable like 5 or 6 years ago.
之后的一个方法呢，就是说我们也会提到是存在一个术中相差测定的一个方向，是这个测定是不是我们今后可以发展的一个方向呢？当然，在我们欧洲包括亚洲以国际上的一些会议上也都提到了这样的一个方法，但是呢，我本人对这个方法呢并不是特别的喜欢，因为呢我们可能它相关的影响因素呢很多，但至少呢 这是一个我们曾经使用过的方法，也是可能某些医生喜欢的一些方法。OK。
So then IntelliAxis came into the game from femtosecond laser-assisted cataract surgery, and that was a real game changer because you could do it in peribulbar anesthesia. So you had a real improvement of workflow and patient compliance. And the corneal marks of the target axis with the Lensa IntelliAxis were under cyclotorsion control. So cyclotorsion adjustment was perfectly matched.
然后我们再来提一下这 IntelliAxis， 这样的它呢确实是一个我们叫一个规则改变者，对我们的整体手术的流程呢有非常好的这样的一个改进。然后它呢也可以在球轴麻醉下呢完成，对于我们整个工作流程和患者的依从性呢都有很好的帮助。而且呢，这样的一个机器使用的这样的一个眼球旋转的控制，它的标记的这准确性呢得到了一个非常明显的一个提升。OK。
So here I want to show you the IntelliAxis system step by step. It's collecting data of the cornea and the iris. It does an iridography at the same time.
之后现在呢，我跟大家逐步的讲解一下 IntelliAxis 它的一个步骤。首先，第一个呢就是获取角膜以及虹膜的数据。OK。
Then here you can see how the LED video keratography collects all the data from the steepness of the cornea, the axis, and not only from the anterior, but also of the posterior cornea. As we all know, those two axes together at the end are the all-over corneal astigmatism. So I think that was a real improvement.
然后呢，我们就可以通过这个分析到的这个角膜以及虹膜的数据呢进行显示。这里面呢可以看到角膜的这个陡峭的轴位，而且呢不光是前表面，包括角膜后表面呢都能够显示出来，这样对我们术中的这个选择呢就会有很大的这个帮助。OK。
So then those data were transferred or are transferred via Wi-Fi to the femtosecond laser cataract surgical laser. So you don't have problems in your workflow. The data go directly from the LED Cassini to your laser, which also is in the sense of quality management great because you can't make any mistakes. All the data are transferred because the patient gets a number and then this is transferred into the laser. So it's not only good workflow, but all the high quality management control.
然后在我们测量结束之后呢，就可以将数据呢直接通过 WiFi 直接传输至我们的飞秒激光手术的一个仪器，然后这样呢，它也可以对我们的工作流程呢有一个直接的一个改进。这样我们就使用一个固定的一个患者的一个编号，这样可以保证数据传输的时效性，也好包括它的准确性，对于我们整个工作的流程和我们手术的质量提升都有很大的帮助。OK。
So here you can see how the automated iris registration works, how the data is transferred on the laser, and then the laser does do marks on the cornea. Here you see not the marks, here you do see astigmatism correcting astigmatic keratotomies, but the principle is the same. You just don't penetrate, you just mark in the stroma. So you just do 2 intrastromal marks on each side on the target axis.
然后之后呢，我们就可以在这个机器以及显微镜下呢，它首先呢是通过虹膜进行一个定位，然后之后呢，我们就在这2个机器的对比之下，可以充分的对眼球呢进行一个补偿，然后之后我们就可以通过对激光，包括我们对角膜的本身的这个情况呢进行观察的情况下，在角膜的基质层中呢进行一个标记。我们并不是要把它充分的穿透，只是在角膜的基质层进行一个轻轻的标记，这样在术中呢就能够观察到。OK。
So here a little explanation of the principle. Okay, and here you can see the marking process. So you see it's 2 marks each side and intrastromal very small marks.
这就是我们标记的一个过程，一个录像。大家可以看到呢，在角膜的这个两侧的就前基质的地方，可以看到2个很小的标记的这样轴位。OK。
Oops, going back. Okay. Here you can see the implantation of a toric ICL according to the corneal marks. Here we go. You can see the marks on the ICL and the corneal marks in the cornea. And so it is really easy to adjust. Now at the end, perhaps it's a little bit difficult to see because the magnification is not big enough, but the mark is here and the other mark is here. So it is very easy to adjust during surgery.
然后这里面呢，就是这个根据角膜的定位的标记呢，我们进行 TICL 植入的这样的一个手术的录像。我们看到在手术结束的时候呢，仍然可以非常清楚的看到我们标记的这个位置。当然，这个可能与这个显微镜的放大的倍数有关系啊，稍微小一点，但实际上我们仍然可以非常清楚的去看到这个标记。OK。
Okay. So today we again changed because we bought another excimer laser, the Schwind laser Amaris 1050 RS, and we do a cyclotorsion controlled smart surf trans-PRK on the target axis under topical anesthesia, and then we do the peribulbar anesthesia for surgery. The good thing about this is that this can also be done by an optometrist. The surgeon doesn't have to do it by himself because the trans-PRK marks cannot harm the cornea. There is no risk of any complication. The only thing you have to do is once you do this mark, the patient should be 30 to 60 minutes later in the OR that you implant the ICL. And usually I cover the cornea with OVD, with methylcellulose. I don't do this in the implantation of toric ICLs. Why? Because the trans-PRK marks are easily covered with OVD, and then it's hard to detect those. So that's a personal tip and pearl. Once you start with this method, the trans-PRK marks, please don't use OVD because it might cover your marks.
然后呢，再来介绍一下，这也是我们最新买的这样的一个阿玛仕1050 RS 这样的一个设备，我们也可以使用这 trans-PRK 的这样的一个方式呢，对我们的这个角膜轴位呢进行标记。在这里面呢，它的一个好处是什么呢？就是说它在表面麻醉之下呢，就可以由我们的助手或者说我们的这个本身验光师或者视光的医生完成这样的一个步骤，因为本身的这样的一个手术操作呢是非常安全的，对角膜呢不会产生任何的一个损伤。那另外要提2个方面，首先一个呢，就是说在标记的话呢，我们应该是在我们手术之前30到60分钟这样的时间里面完成，这样呢才能够更好的在术中呢观察到我们角膜的标记。另外一点呢，就是说我在常规的植入手术的时候，有的时候喜欢在角膜表面呢涂一些粘痰剂，然后保护我们的角膜。但是如果我们使用 trans-PRK 这样的一个标记方式的时候，就不要使用 OVD， 因为这样呢有可能会对我们的这个标记呢的观察产生一些影响。OK。
So here you can see how it is done. We collect the data from aberrometry and from video keratography. Those data go into the Amaris 1050 RS excimer laser, and then we do the trans-PRK.
这个呢，就是我们正常操作的一个流程。首先呢，仍然是收集眼部的包括角膜形态等等这些数据，然后把数据呢传输至机器中，然后之后呢就可以使用 trans-PRK 呢完成这样的一个标记。OK。
The good thing about this laser, what I really like also in excimer laser surgery, it has a so-called 7D tracker, eye tracker. It looks for vertical movements, for vertical rolling movement, for axial movements, for horizontal movements. It has a cyclotorsion control. And those are, I think, if you compare this to our start, when we started to mark the cornea, really great improvements.
这样的一个标记的方式呢，它是这个世界上最快以及最好的一个追踪系统，包括它垂直位的、水平位的以及旋转位的各个位置，它都能够有一个非常好的一个追踪，达到了一个全方位的一个追踪的效果，可以完成一个非常精准的一个角膜的定位。OK。
Yes, that's what we basically do. The trans-PRK is a method we use.
仍然是说的这个 trans-PRK 是我们目前使用的一个非常值得推荐的一个方法。OK。
The advantage, we think it's delegible. You don't have to do it yourself. It's very cost effective because we don't have the laser anyway, and it's absolutely pain-free.
它的优点呢，包括以下几个方面。首先就是操作性很强，不用由主刀的医生自己的完成。另外呢，它成本的效益呢也很高，没有额外的这个花费。再有一点呢，就是患者呢很舒适这个过程是没有疼痛感的。OK。
So this is the summary of today's talk. I think the history when we did stained marks with a precision, patient compliance, workflow and delegation problems, that was not bad. I mean, it was in between 1 to 4 or 5 degrees, but today with cyclotorsion control, no touch, pain-free, indeligible marking, we really reached another level. And I would say with this, we turned art into science.
这就是今天呢对我的这个讲课内容的一个小小的一个总结。首先呢，就是从历史上呢，我们还是使用手动标记是使用染色的这样的一个方法。它无论是从精度还是患者的依从性以及工作流程等方面呢，还是存在了一些问题，而且它的准确性呢，有可能会存在着1度到比如说4、5度左右的一个轻微的这样的一个差异但是我们今天呢，有了更多的先进的手段，我们可以在一个非常优秀的眼球旋转控制的情况下，采用一个无接触无痛的方法呢，完成一个非常精确的一个角膜标记。那么说呢，我们今天终于可以把艺术呢变为了科学。OK。
So thank you very much for your kind attention, and I'm coming to the end of my presentation. I'm looking forward to critical questions. I think there will be some for sure, and I'm happy to hear about it. And on the other hand, I also had already Chinese doctors in my operating theater. Whenever you want to come, this is an invitation. Thank you very much.
最后呢，非常感谢大家的聆听，然后呢，也欢迎大家有什么问题呢，可以提出来，大家一起进行讨论。然后我的手术室呢，也有中国的医生，所以说如果任何时候大家愿意来德国的杜塞尔多夫来我的手术室参观的话，也非常欢迎大家。